Hello everybody, welcome back to Study with Rinky, and today we are going to learn about Apgar Score. It is a tool which is used to assess baby's health after the birth in 1 minute and 5 minutes. Scores are given on the basis of 5 criteria. A for appearance, P for pulse, G for grimace, A for activity, and R for respiratory effort. Okay, the score are 0, 1 and 2, and on the basis of the criteria we are giving the scores. So first one is appearance. Specifically it denotes the baby's body color. If the baby's body or extremities look pink, then we are giving score 2. But if the baby's extremities are blue, which is known as acrocyanosis, then we are giving the score 1. And if the baby's whole body is blue with cyanosis, we are giving the score 0. The next criteria is pulse. If the heart rate is more than 100 beats per minute, we are giving the score 2. If the pulse rate lies between 60 to 100 beats per minute, the score is given as 1. If there is no heart rate or the heart rate is less than 60 beats per minute, then the score is given as 0. The next criteria is G for grimace, which means irritability of a newborn on stimulation, or we can say it reflex irritability. If a baby cries after a stimulation, the score we give is 2. If a baby's cry is very weak after a stimulation, then the score we give is 1. If there is no response after stimulation, the score we give is 0. So the second A stands here for activity. So here we are seeing the muscle tone of a baby. So we are giving 2 score if the baby flexes and resists extension. 1 score is given if we can see there is some flexion, and 0 score is given if there is nothing. If the baby is floppy, their muscle tone is absent, then we are giving 0 points. Last one is the respiratory effort. In the respiratory effort, 2 scores are given if the baby cries very strongly. 1 score is given if there is a weak cry and labored breathing. 0 score is given if there is absence of respiratory effort. Score in Apgar ranges from 0 to 10. The normal score is 7. If the score is between 4 and 6, which indicates the baby is moderately distressed. But if the score is less than 3 or equals to 3, which means baby have severe distress. So this was all about Apgar score. See you in the next